Binge eating disorder. Recognizing the symptoms to overcome binge eating disorder. Eating disorders, such as binge eating disorder, can be defined as serious mental health conditions, and they can affect your overall health and well-being in various ways. People living with eating disorders might have an unhealthy relationship with food and eating, or an unrealistic and damaging view of themselves. Hi, I'm Sreela Roy-Greene, PhD, LMHC, a licensed therapist with BetterHelp. Today, we're going to be talking about binge eating disorder, what it is, signs and symptoms, causes, treatment options, and supportive strategies to aid in recovery. But first, let's define eating disorders in a broader sense. What is an eating disorder? Eating disorders, or EDs, can be defined as an irregular pattern of dietary or eating habits, such as a routine binge pattern or regular underconsumption. Eating disorders may be influenced by one's mental state, negative body image, or negative self-perception, although those thoughts don't have to be present for someone's experience to be designated a true eating disorder. Eating disorder symptoms are not limited to starving oneself and can also include exercising excessively and binge eating behavior. And unlike common media portrayals, anyone of any size can have an eating disorder. According to the National Institute of Mental Health, there's also a common misconception that eating disorders are a lifestyle choice. In reality, eating disorders can be serious illnesses that can cause or worsen many medical problems, and eating disorders might be fatal if left unaddressed. Now that we've defined eating disorders as a whole, let's take a closer look at a common type of ED, binge eating disorder. What is binge eating disorder? Johns Hopkins Medicine defines binge eating disorder, or BED, as an illness involving the intake of a lot of food in a short time. A person living with binge eating disorder may feel out of control about how much food they consume on a day-to-day basis or in specific situations such as at a buffet or party. This can affect their health as BED begins to take both a physical and emotional toll. According to the National Institute of Mental Health, binge eating disorder is considered to be the most common eating disorder in the U.S. Although people of any age or gender can develop binge eating disorder, some people, such as those in certain racial or ethnic groups, age ranges, or genders, may be more at risk. Signs and symptoms of binge eating disorder. So what does binge eating disorder look like? In general, those with binge eating disorder binge eat food in a way that seems out of control. Although it can affect people of all sizes, weight gain and unhealthy body weight can be associated with binge eating disorder in some cases. Other common symptoms of binge eating disorder can include binge eating a considerable amount of food in a set period of time, such as 1 or 2 hours, hiding your food intake or eating in secret to avoid embarrassment, continuing to eat even when you're not hungry or already full, frequently trying new diets, even without experiencing weight loss, eating until your stomach is uncomfortably full, or finally feeling ashamed, guilty, or distressed about your eating habits. Sometimes the eating habits that accompany binge eating disorder may contribute to concerns like excess weight, low self-esteem, and high blood pressure as well. It can be important to address both mental and physical health concerns, as binge eating disorder can lead to heart disease and additional health problems. It's also important to note that only a licensed mental health professional can diagnose binge eating disorder or any other eating disorders. If you believe you may be living with binge eating disorder, consider scheduling an appointment with a professional to have binge eating disorder diagnosed and treated. Working with a professional can empower you to get the binge eating disorder treatment you deserve for any challenges you may be facing. Treating binge eating disorder. If you or a loved one has been diagnosed with binge eating disorder, there are many treatment methods that may be effective on the road to recovery. Some individuals may benefit from attending support groups, learning and practicing intuitive eating techniques, or working with a licensed dietitian. If you think medication may be helpful in your treatment plan, speak with your doctor or mental health care provider, and they may prescribe FDA-approved medication that may help manage binge eating symptoms. Finding ongoing support. If you're looking for support to help manage binge eating disorder or another mental health condition, you might consider working with a licensed therapist through an online platform like BetterHelp. And if you found this video helpful, remember to like, subscribe, and turn on notifications for more tips on improving your mental well-being. In the meantime, check out our other video on CBT therapy to hear more from another one of our licensed therapists on how cognitive behavior therapy works. Binge eating disorder can affect your physical and mental health in many ways, but there are many treatment options and support strategies available to help you regain control of your eating habits and live a healthier, happier life. Thanks for joining us today. Take care. Don't forget to subscribe, and we'll see you next time.